Hi everyone, I'm Dr. Tani Ping, consultant obstetrician and gynecologist. Okay, I changed my backdrop a bit to make us feel more cheerful a bit because all of us are now very depressed. We cannot go anywhere. I remember one of my staff told me she's very depressed. Today she told me because we can't even go anywhere. Now she wants to see the beach. She cannot go to the beach. We can't go holidays, not even locally. It's quite depressing. So let's have a change of backdrop. So we can't go overseas. Let's have some backdrop as our overseas just to cheer everybody up. So I decided to change my backdrop today. Okay, so today is a topic that is very relevant to everyone. And actually, why I want to have this topic, partly somebody did suggested. So this is again your question, not my question. This is a topic suggested by you. And I also feel that this is probably a very nice topic to discuss because there's a lot of misconception. A lot of people don't really know what is a menstrual cycle, what is their menstrual cycle, and a lot of knowledge about menstrual cycle is based on what you learn from school, which is not really true in reality. Yeah, so that's why I want to bring this topic up. So this knowing what is a normal menstrual cycle is important for few situations. The first situation is I want to know what's normal, what's not normal, so that I know what is not normal, that I know when I need to see doctor. So you need to understand what is normal, what is not normal. Then only by knowing what is normal, then only you will know what is not normal. Then only you know when you need to see a doctor. So that is why I think each and every woman needs to know what is a normal menstrual cycle in the first place. Number two is a lot of women actually use menstrual cycle for certain past time of their life, for certain phase of their life. Like when they're trying to get pregnant, they are using their knowledge that they know about menstrual cycle to plan when they need to have sex with their husband to get a baby. And very often I realize that women, just based on simple things they learned back in school, day 14, so they have sex on day 14 and they expect to get pregnant. I believe some people do get pregnant by having sex on day 14, but that's not the majority. Majority don't get pregnant on day 14. So very often when you see them telling you that, and then when you actually look at their menstrual cycle, you will realize that it's not actually true. And there's another phase of life that women use menstrual cycle again. If they don't use it properly, they get into trouble as well. Is when they try to plan when is the safe period to have sex and when is fertile. You know, women use this knowledge to plan when to get pregnant, but also they also use this knowledge to plan when not to get pregnant. So there are a lot of women out there who don't use any form of contraception except counting the days. So counting the days is something they do, but if they don't count properly, that's when they get caught. That's when they get pregnant. So there's so many women who come to me. They're so shocked that they're pregnant. They have been counting the days correctly. Everything has been going on fine. One day they just got pregnant. You know, you've been counting your days correctly and it could work for you for quite a long time. But one day, it will just make you pregnant. You know, you get caught. You actually get pregnant even though you count your days properly. Okay? So that is why knowledge. You need to have some knowledge in order to be able to get it all right. Okay? Alright, so let's start with what we know. We know that menstrual cycle based on our textbook is 28-day cycle. We learn in our textbook one cycle, you know, we used to draw that graph all through your secondary school. That is 28 days. Day 14 is ovulation. Day 28, after 28 days your period come again. So we have been drummed into our heads, you know, right from school days, that menses is every 28 days and day 14 is the ovulation. We learned that for so many years. We write that in our essay. Every day we write that. But is it really true? How many of you actually have menses 28 days? If you have menses 28 days, please click like. Please click onto the like button. If any one of you out there who actually have a menses that come every 28 days, please click onto the like button. That's the first thing you need to do and see whether it's true or not. No likes? Okay, so You see, I'm waiting and waiting. There's still no lights. So, you see, very few women actually have menses every 28 days. So the first thing you need to understand, menses is not 28 days. Okay. Then I have a second question for all of you. Which one of you have the fixed number of days? That means I don't care how many days. If it's 24, it's always 24. If it's 28, it's always 28. If it's 30, it's always 30. So, how many of you actually always get on the same day? If yes, please click the love button. Please click the love button. So you can see the number of responses that I get is not really a lot. So that is why you need to understand that menstrual cycle does not follow what we learn in school. That's why I always tell a lot of patients, number one, you need to understand we are human. We are not machine. We don't follow a fixed number. So the first thing you need to know, menstrual cycle is more often than not never 28 days. More often than not. In almost everyone. Number two, you need to understand also, very rarely you get people who have fixed cycle that is 28 means forever 28, 30 means forever 30, which is also very rare. So actually most people don't have 28-day cycle, and most people also don't have a fixed cycle. Another thing is day 14 ovulation again is not true. It again is not true. Even if your cycle is 28 days, day 14 ovulation is also not true. Because when we do fertility cases, we time them, we scan and catch the ovulation date. So many times it has proven to us that even if I know when you actually ovulate, even if it's day 14, your menses don't come after 28 days. Very often it doesn't happen that way. So again, all these things are not true. So I think what happens in our biology lesson, our science lesson, is that they taught us that 14 days, 28 days is just like an example. It's an example of one person. That certain people can have this, but it's just an example of a cycle, so that it's easy for everyone to understand. But in reality, very few women out there actually follow the textbook. Next, I want to ask you all. A lot of people feel that they always tell me, I say you're not ovulating. Then she say, but my menses come ah. You have menses? Does it mean you ovulate? Because that's what we learn in school, right? Day 14 ovulate. Day 28 menses come. So when your menses come, does it mean you ovulate? The answer is again no. Because we know there are two types of menstrual cycle in this world. There are two types. One is ovulatory cycle, which is what we learn in science. Ovulatory cycle. Another cycle we learn is non-ovulatory cycle. Means cycle that doesn't ovulate. So even if you don't ovulate, you can still have menses, you know or not? So you see, there are a lot of women out there who have menses every month, and they think that they should be fine. I have my menses every month, I should be fine. So I should be ovulating. So I should be able to get pregnant. It's not actually true. It's not actually true. So these are the few things you first need to understand. So number one, our cycle can be any number of days. It can be, we say, normal menstrual cycle can be from 21 days to 35 days. Anything within 21 days to 35 days is considered a normal cycle. But even if you have a normal cycle, we are not exactly 100% sure that you're ovulating, number one. If you don't have a normal cycle, That means your cycle is 40 days, 45 days. Some women are very proud to tell me, oh, my menses is very regular one. Every 40 days will come. Every 40 days will come. If it's 40 days, I don't consider it regular at all. Even though, yes, it comes every 40 days, but it's not a normal menstrual cycle anymore. Number 2, you need to understand is the date of ovulation is not always day 14. In fact, it's rarely day 14. So if you're going to use this formula to count, whether because you're trying to get pregnant or whether you are trying to prevent pregnancy, you will get caught. So if you count, you're trying to get pregnant, you see you can't get pregnant. Maybe because your ovulation is not day 14. Or you're trying to prevent pregnancy. You keep counting, trust me, one day you'll get pregnant. Because ovulation date keep changing. It's never fixed on one day. So these are the first main thing you need to understand. So these are the things you need to understand so that you know when is the best time to get pregnant. And also, you need to know that because you need to know that calculation of dates to prevent pregnancy is not safe at all. Especially even for certain women, they have like almost regular menses. That means they know their menses is more or less the same time. Maybe not 28 days, sometimes 30, sometimes 32, sometimes 28, sometimes 26. But it's more or less the same time. So they actually use formula to count to decide when to have sex, when it's safe to have sex. But I tell you, women, especially when they reach their 40s, that is when we say when we reach our 40s, our menses start to get a bit haywire. It's that time that they get pregnant. They can be counting dates all their life and never got pregnant, but in their 40s they'll get pregnant. You want to get pregnant when you're in your 40s or not? So if not, then don't use calculation. If you use calculation, the time that you will get pregnant is when you're in your 40s. If your menses date is not fixed, then you cannot use calculation. So to be on the safe side, don't use calculation. You must use something else. So you don't calculate safe period and fertile period. It doesn't work. And for fertile period, don't calculate. It will never work because there's no fixed ovulation date. What you learn in textbook is more or less. Okay, I have seen people ovulating on a certain day. Menses come 14 days later, which is perfect. According to textbook, after ovulation, 14 days, your menses come. But we have people who after ovulation, day 10 menses come. Day 11 menses come. Day 14 menses come. Day 16, 18 also got. Sometimes you know they ovulate already. But the menses only come 18 days later. So again, it is not very accurate. So you cannot use calculation to predict when is the best time to have sex. So some of you, when you're trying to get pregnant, you actually buy an app, you download an app to tell you when is fertile period. Trust me, that one cannot use one. Why cannot use? Because they follow the theory that the textbook teach you. How does this app writers, app designers come up with the app? Based on what? Based on all the knowledge you learn from textbook. But in reality, human is not robot, yeah? Human is not robot. Human is not computer. There's no fixed numbers to anything as long as human is concerned. There's no fixed number. There's no fixed number. In medicine, there's no fixed number. What is normal blood pressure? Keep changing. You know, I've been doctor for like 20 years, 20 plus years. These 20 plus years, what is normal, what is not normal, or blood pressure also can change. When to start medicine, when not to start medicine, keep changing. Even things like sugar level, when is normal sugar level, when to start medicine, when not to start medicine, keep changing. Human, there's no fixed number. Even our cholesterol level also keep changing. Last time they say cholesterol must be certain number, only high. Now it's a different number. Keep changing. Human number keep changing because there's no one number that tells you what is normal. So you cannot use a number to calculate fertile period, and you cannot use a number to tell you when is safe period to prevent pregnancy. That's what I want all of you to know today, because there's no fixed number. Okay. The other thing I just want to explain is what is normal menstrual. So normal cycle, I mentioned already, it should be between 21 days to 35 days. And it should come every 21 days to 35 days, even if the days do change. But as long as within 21 days to 35 days is fine. And the flow of your menses should be the same all the way. One day too little, one day too much, it's not right. One day menses come before 21 days, it's not right. Menses come after 35 days, it's not right. If your menses every month is after 35 days, it's definitely not right. If your menses every time come less than 21 days, it's definitely not right. If your menses come less than 21 days, I am really worried of things like endometrial polyp that can eventually become cancer. If your menses is always more than 35 days, I'm very worried about polycystic ovarian syndrome, or some people call it PCOS, which is also high risk of uterus cancer. And if your menses become too heavy, I'm also very worried. You may have fibroids or adenomyosis or adenomyomas or even polyps. If your menses is too little, I'm also worried. Maybe you're pregnant. Maybe you're not pregnant. Even heavy can be pregnant. Just a few days ago, I had one lady who had such a heavy menses, and I asked her, could you be pregnant? And she said, I'm having menses. And turned out she was pregnant. So whenever things are not right, we need to see doctor. Don't presume it's normal. Anything can be possible. So you need to know what is normal and what not normal. So I'm not going to deal into detail what is PCOS, what is endometrial polyp, what is endometrial cancer or fibroid. They are all in my YouTube channel. So if you want to know more, if you have an abnormal menses, you want to know more, please go to my YouTube channel, Dr. Tan City Clinic. The link is in this post. Go to that link, go to my YouTube channel, subscribe to my YouTube channel, and browse through all my old videos. I already have videos on abnormal menses, on endometrial polyp, on uterus cancer, on fibroids, on adenomyosis. All this, I had it already. So go and look through. If you have an abnormal menses, you better know what's going on. And if you are trying to do contraception, you're counting dates, and now I told you, if you count dates, even if it works for you all your life, in your 40s, you're going to get pregnant. Because in your 40s, your hormone cycle is going to disturb. You're going to ovulate at funny time. You're going to have funny cycles. That is when you get caught. That is when you get caught. So, want to know more about contraception? Go to my contraception video. Okay? So, yeah. I guess that's all for today's talk. If you have any questions, please put up in my comment section. In fact, I see a lot of questions coming up. And you have anything you want me to talk about also, please put it up in the comment section. I will put up in the list, and I will talk about it in the future live videos. I will go as I go along. I will cover most of them. And for those of you who have not subscribed to my YouTube channel, please subscribe to my YouTube channel, yeah? Let's go through all the questions that you have for today. Yep. I hope you like my new backdrop. Okay, I bring you to holiday. This reminds me of Japan actually. No, cannot go Japan. Let's have Japan. I'm not sure whether it's cherry blossom or plum blossom, but anyway, it's not Malaysia. Okay, we need to have something to cheer us up on and off. I really hope that this MCO will go away as soon as possible. But we know it's not going to be so soon. Although life is quite normal, not too much difference for most of us. But I guess it is still not the same. We definitely love to have the normal life that we used to have those days. Farhana mentioned that her menstrual cycle is less than 28 days. So as I said, not everybody menstrual cycle is on the dot 28 days. And there are people who menstrual cycle are so short, it can be 21 days, 22 days. And do you know that these people, in order to get pregnant, sometimes they need to have sex during menses. Wow, stress, man. Because Muslims cannot have sex during menses. But then they are only fertile during menses. How? Yeah. But for non-Muslims, I have quite a number that came to me not pregnant, and then I look at their cycle is 21 days, 22 days. I told them, please have sex during menses. And true enough, they got pregnant. Yeah, you need to have sex during menses for those people, okay? Fatin Nasra said, I miss having a regular period. I hate this PCOS. Well, yeah. I also have PCOS. If you go to my PCOS video, you will know that I did mention that I have PCOS too. But I am one person that never hated my PCOS cycle. When I was a child, I actually enjoyed it. 2 menses every month lah, so troublesome. If I had menses every few months once, actually saved me a lot of headache. Now that I'm a lot older, it was only a little bit of problem during the phase where I was trying to get pregnant. So pregnancy journey was a bit complicated, but was solvable. I always say PCOS is solvable. PCOS is solvable, just don't be too old. When you're too old and you're trying to solve it, then it can be a bit difficult. But now I put in a Mirena, so I don't care about my PCOS anymore. I hardly have any menses. I'm very happy living with that. Ellie Liana also mentioned that her menses is sometimes 3 to 4 months, so that is also not normal. It is not normal to have menses more than 35 days because you're at risk of uterus cancer. That is why I put a Mirena inside my uterus so that I don't get uterus cancer. Okay? Farhana said, true, I feel like sometimes ovulation is not happening. Yes, it's quite true because we have ovulatory cycle and we have non-ovulatory cycle. So for people who are trying to get pregnant, if you have been waiting too long, you should go and find out whether you are having ovulatory cycle or non-ovulatory cycle. Sujin has a very interesting statement. Sujin mentioned, haha, we female is just complicated. Yes, female is very complicated in many sense. Which reminds me of a joke that I had during a Caesar that I did a couple of days ago. Because this is a new hospital. Sunway Velocity is a relatively new hospital because only up, I think, about 1 to 2 years by now. So a lot of the nurses are also still quite new with whatever the things that I've been doing. So when I do Caesar, I don't let them touch my Caesar. I don't let them touch I don't let them touch the uterus of my patients. And they also say, yes, many doctors have their own peculiarity when it comes to touching the uterus. Some don't let the nurses probe, some don't let the nurses wipe, some don't let different things, but somehow we don't really like our nurses to touch the uterus when we do a Caesar. I say, uterus is like a woman's heart, easily hurt, please don't touch it. Okay, it's true. When we do Caesar, we just don't simply touch the uterus. It just keep bleeding. Don't touch it. So we don't allow anyone, I am very particular, I don't allow anyone to touch the uterus of my patient, except myself. Amy asks, how to check do I have ovulation or not? Yeah, there are a few ways. Blood test is one. Yes, you can do a blood test, which is a progesterone level. We always say mid-luteal progesterone level. So that one needs to be done 1 week before your expected period. So if you think your period is going to come on the 20th of November, then you take the blood on the 13th of November, okay? So yes, you can do blood tests to predict ovulation. In fact, blood test is the very accurate method to predict ovulation, a very, very accurate method. The other one would be actually seeing the ovulation by ultrasound scan. That means I follow your ovary through your cycle and actually saw evidence of ovulation. 2. OPK test is something a lot of people like to do, which is ovulation test kit. But ovulation test kit is not really 100% accurate. It has its issues and problems at times for certain people, especially people with PCOS, because it's measuring LH, and people with PCOS have high LH at all times sometimes. So it doesn't mean they're ovulating, so it's not necessarily accurate. And some people like to use temperature. Again, it's not always accurate. Amy asks again, may I understand why period will come since no ovulation as on 21 days, Yasmin? When you take Yasmin or any oral contraceptive pill or even any hormone pill, The hormone take over your body. So nothing to do with ovulation. The hormone stop the ovulation, but the hormone take over your body in the sense that it takes over your entire hormonal cycle. So your cycle now is not your cycle. Your cycle is Yasmin cycle. Hi Sukai Pua. Notice recently that there are some more environment friendly women hygiene products in the market now, like menstrual cup. Do you recommend to use them? No harm. Menstrual cup is something good to use as well. In fact, sometimes it may be better than menstrual pads, because actually menstrual pad got a lot of problems. Not an issue at all. It's not just for environment, but menstrual pads, actually, if you look at it, because our menstrual pads today are no longer cotton, you know. When you cut the menstrual pad and see what is inside, there are lots of things inside, and as a result, there are a lot of people with allergy, infection, all because of menstrual pads. So, yeah. Of course, menstrual cup is not an issue. Chua Beng Yi asked about body temperature can monitor time ovulation. I told you can, but not very accurate either, because there are a lot of things that can affect your body temperature. So not necessary is that accurate. Esther Kui asks, hi doctor, most of my gynae calculate my ovulation like this. Some use apps to calculate it. Yeah, I mean, if you're going to ask me, I also calculate for you one. But we know it's not really accurate. If you're going to ask me to calculate, I will also follow this type of formula to calculate. But unfortunately, we know it's not always accurate. That's all I can say. Because some women who come, I notice they are not calculating properly. I also calculate for them. I say, nah, your fertile period is this time. Don't start having sex in all this funny period. But we know it's not always accurate. So when you actually find it difficult to get pregnant, then we have to think of other ways. We cannot just use this time ovulation, especially if we know you already calculated properly. Asia Rosti asks, can we get pregnant even though it is after our ovulation date? 1-2 days after can still get pregnant. But the question is, Asia, when is your ovulation date? That is the question. Unless you work for me lah. You know my nurses, those nurses in my clinic, they can have PCOS or anything, no issue one. You know why? Because I have a sonographer. When they want to get pregnant, they just go and see my sonographer every day. See my sonographer every day and catch the ovulation period. They are so smart, man. I have a few PCOS in my clinic and they got pregnant quite easily, because every time they want to get pregnant, they will just go and see So-E, which is my sonographer, that will time their ovulation period for them. So, and time not by calculating, but actually looking at the egg. They look at the egg every day. You know, you come and see gynae, you can't see every day. Of course, you can come and see every day, but you have to pay every day. So working in my clinic is most convenient. So the every day time the ovulation. Scan every day until you catch the ovulation time. And as I said, ultrasound scan is very accurate because you actually saw it. What would be the best method to determine if one is ovulating besides going to a clinic for a scan? I mentioned already, blood test and scan. These are the most accurate method. Other than that, all the others you can use, not 100% accurate, but can be used as well. You can buy OPK, you can do a temperature chart, but not 100% accurate. But still okay, reasonable lah. But I would not use that as a proof of ovulation, because when people come with fertility issues, they will come with all these things. I won't regard that as an ovulation proof. I will still want to see it on ultrasound scan or a blood test. Linda Elena asks, can we rely on ovulation test kit in the market to check monthly ovulation? As I mentioned, not really reliable, because ovulation test kit measures our LH level, and people with PCOS can have very high LH levels as well. So it's not always accurate. Fia Maro asks, why women with high chances of this complication, or is it because food intake or other? No. Complication is due to your menses not normal. I don't understand what kind of complication you mentioned, but abnormal menses, because your menses abnormal so definitely you will have higher chances of complications like uterus cancer and polyps. Adiba asks, currently my period more than 14 days and heavy flow even more than 14 days. Adiba, that's definitely not right. Please go and see a gynae. Nobody should have this type of menses one. Okay, it's definitely not right. Something is wrong. If your doctor cannot find out what's wrong, please go and see another doctor. Or just go through all my videos. I did have videos on abnormal menstrual bleeding as well. But most importantly, you still need to go and see a gynae. But you can go through my videos to roughly know what's wrong with you before you see a gynae. Nisa asks, is ovulating pain normal? I get super uncomfortable and bloated during cycle day 10 to 13 and my period is 24 to 29. Nisa, ovulation pain is not normal. You can go and look at my video. I have a video in my YouTube channel regarding ovulation pain and it's definitely not normal, okay? You're not supposed to feel uncomfortable during ovulation. That is a sign of certain problems like endometriosis, pelvic adhesions, pelvic inflammatory disease. Yeah, Fuzia Nadia say, I wish I can go to you for consultation, doctor. Too bad still stuck here in Singapore. Fuzia, I also want to go Singapore because my regular doctor is in Singapore. You know, I used to travel to Singapore to see my doctor. I travel down in the morning, see my doctor and come back. That's how I used to see my doctor in Singapore. And ever since the beginning of this year, I have not seen my doctor. Last I saw my doctor was January this year until now. I also want to go Singapore. But Filza, I do have online consultation if you want. If you want online consultation, please WhatsApp to my staff 012-322-9820. Okay, because I do online consultation. But too bad my doctor in Singapore doesn't do online consultation. I actually asked the clinic. Sad. Okay. Would like to know if cycle like this is difficult to get pregnant when 21-day cycle is very short. Actually, 21-day cycle is not difficult to get pregnant. It's just that you need to have sex during menses. And that is the problem. I mean, for Chinese, non-Muslim is fine. Indians, anyone, non-Muslim is fine. Because you can have sex during menses. There's nothing forbidding you from having sex during menses. But for Muslim religion, they are not allowed. So that becomes a problem. So I had this one lady that is really 20 and 21 days. She's always around there on 21, 20, 22. All her life. And she's a Muslim. I told her to have sex during menses. She died, cannot. So what I did for her was I stopped the menses after day 3. I have to stop the menses. If not, she cannot have sex. Then how is she going to get pregnant, right? So that's something we can do. Sieni asks, my cycle is 27 days. These 2 months become 26 days. And the following month, 25 days. Is it normal? I mean, it's still normal because it's still within 21 to 25 days, okay? Ba Sandra Leo, is it impossible for someone to miss her period like 11 days delayed and 7 weeks delayed and start seeing small bleeding without clots within the 7 weeks delayed? That's not normal. Definitely not normal. Okay, anything more than 35 days is not normal. All this little bleeding is not normal, as I mentioned earlier. Too much bleeding is also wrong. Too little bleeding is also wrong. Sandra says that must ovulation come with white, slippery, thick discharge? No. Ovulation discharge is not a must. It's nice to have so that you know, but it's not a must. But even if you have, it's not a proof of ovulation. Okay? It is a sign of ovulation, but not a proof of ovulation. So there is a difference. Because it's a sign to tell you when you're ovulating, it's nice to know. But if you're not pregnant, you tell me that every time, day what, you have this discharge, it doesn't prove to me that you're ovulating. I still need to prove it either through ultrasound scan or blood test. Amy say, I feel most of the menstrual pad are discomfort. It is hard so far to find good quality menstrual pad. So sad. Maybe, Amy, you're looking at the wrong place. If you find that pads is a problem, one way is to think about cloth pads. Cloth pads are now getting in fashion a bit. Or things like menstrual cup, not an issue as well. Eileen Coy asks, is it true that we must limit caffeine intake if we are trying to get pregnant? I love to drink tea or coffee at least 1 to 2 cups a day. Please advise. It's good to stop because pregnant cannot take. So if you're trying to get pregnant, it's good that you slowly try to cut down. Because pregnant cannot drink coffee, yeah? Okay? We say caffeine is no good for pregnancy, not good for baby. So if you're trying to get pregnant, you should try to reduce your caffeine intake. Any cons for using menstrual cup? I don't think there's any problem. Just don't forget your menstrual cup. You know, some women, when they put things inside their vagina and it's so comfortable, they don't feel it. And let's say your menstrual is not really that heavy anymore, you can actually forget, and that is when we worry about infection. Okay, normally how many menstrual cup using in a day? You know, menstrual cup is a cup you take out, you pour off, you wash, you put back in. So depends on your cycle lor, heavy or not. Heavy days you need to change more frequent. Not heavy days, then you don't need to change so frequent. So that's all. Okay, so that's all the question you have for me today. So as usual, thank you. And for any one of you who have any questions you want me to talk about in the future, please put it in my comment section. Go to the link that I put in this post to and subscribe to my YouTube channel. The link is my YouTube channel, so that you can actually go through the rest of the videos that I have before this. Okay, I see some last minute questions coming in. Let's see whether I can. We still have time today, so I probably will answer it. Lee San San asks, if whitish discharge is a sign of ovulation, then how long is between the ovulation to the whitish discharge? There's no answer to that, because as I told you, there's no numbers to predict human. So there's no numbers to predict human. It's nice to know when you are it's nice to know this ovulation discharge, but it's not accurate. But it's nice to know. But to use that as a sign to tell you when to have sex is again not accurate. Esther Ho asks, when is the safe time to conceive after cyst removal, laparotomy? 2 months. 2 months, yeah, dear? All surgery, gynae surgery is 2 months. Yes. If someone in SG would like to go for a check, gynae, I don't know. I don't go to Singapore to see gynae. Okay? So I go Singapore to look for my doctor, but not gynae. I don't go Singapore to look for a gynae. It's some other doctors. I just found one very nice doctor in Singapore. That's why I go to Singapore. It's not a gynae. I had a lot of feet problem. My problem with my foot. And in Malaysia, I went to see 8 doctors and it couldn't cure me. And I almost gave up, so I told myself, why not I go Singapore? And then when I go Singapore, I went and did a bit of research, and I went and see a few doctors. I didn't just see one, but somehow there was this perfect doctor there. And I think it's just him and me, he seemed to be able to solve my problem. Nothing to do with whether Singapore got better doctors or Malaysia got better doctors. I think everywhere got good doctors as well. But probably I didn't find the right doctor in Malaysia, even though I went and see like almost 10 doctors. So at the end, when I went to Singapore, I found this perfect doctor, and I know he's also Malaysian, so well, it's fine. Anyway, that's why I go to Singapore to see my foot doctor. If you want to know who is a good foot doctor in Singapore, that one I can recommend. Okay, Basandra Leo asks, how long to conceive after fibroid surgery removal? Fibroid surgery is 6 months. 6 months, yeah? Okay. All right. Thank you. That's all for today. Bye-bye.